Hi, my name is Ling Ling, and I'm gonna tell you about the parts and the functions of our kidneys.
Two kidneys lie on the posterior wall of the abdomen outside the peritoneal cavity, and therefore it is known as a retroperitoneal organ. The normal weight of each kidney is 150 grams, and it is about the size of a clenched fist. The kidney is a bean-shaped organ with an indented medial side, called the hilum, through which passes the renal artery, vein, lymphatics, nerve supply, and ureter, which carries the final urine to the urinary bladder, where it is stored until we empty it. The kidney is surrounded by a tough, fibrous capsule that protects its delicate inner structure. If there's an inflammation of the capsule, it causes pain that radiates through the lower back because, again, our kidneys are retroperitoneal organs. The kidney, if it is bisected sagittally, means from the top to bottom, the two major regions visualized are the outer cortex and the inner medulla. When the medulla is further divided, you will find multiple cone-shaped masses called renal pyramids. Each base of the pyramid originates at the border between the cortex and the medulla, which terminates into the papilla, which projects to the space of the renal pelvis. The pelvis, which is a funnel-shaped continuation of the upper end of the ureter. The outer border of the pelvis is divided into an open-ended pouches called the major calyces, and it extends downward to divide into the minor calyces, which collects urine from each papilla. We go to the nephrons. The nephrons is the functional unit of the kidneys. Each kidney contains about 1,000,000 nephrons, which is capable of forming urine. The kidneys cannot regenerate new nephrons. Therefore, with renal injury, disease, or normal aging, there is a gradual decrease in nephron numbers. And then each nephrons, it contains a glomerulus, which is a tuft of capillaries through which large amounts of fluid are filtered from the blood, and long tubules, in which the filtered fluid is converted into urine on its way to the pelvis of the kidneys. Any injury to the glomerulus, like diabetes mellitus, it causes leakage of sugars and amino acids to the urine. Hence, an increase in glucose and amino acids, you will see it in your urinalysis. An injury to the tubules can cause acid-base balance disorders, which it compromises the broad spectrum of acute renal failure.
Again, this is Ling Ling, reporting and helping my sister with her project about acute renal failure. I hope you have a nice day. And coming up next is a topic and a discussion about acute renal failure. So stay seated, stay put, and please listen. Thank you.
Good day. Welcome back to another interesting and educational day shooting live from Stanford Hospital. Oh, what a wonderful day it is today. It always feels good to be back at campus. Oh boy, do I remember those old days. But now let's get back on track. For our top stories we have, why did the chicken cross the road? I sure would love to know. Who came first? The chicken or the egg? Will we ever find out? Who knows? And for our top story, we have acute renal failure. What is acute renal failure? Where does the disease come from? And most importantly, how do you cure it? To answer these questions, we have a specialist on the subject, a beautiful, smart, and the lady with all the answers. Erth Jones.
Hello, Orlando.
How are you doing, Erth?
I'm doing well. How are you?
Oh, it always feels good to be back here with you.
Thank you for having me back.
Erth, can you explain to our viewers what acute kidney failure is?
Absolutely, Orlando. Acute renal failure occurs when your kidney is unable to filter waste products from your blood. When your kidney loses their filtering ability, dangerous levels of waste may accumulate in your blood's chemical makeup, make it out of balance. Acute renal failure may develop rapidly over a few hours or a few days. It is most common in people who are already hospitalized, particularly in critically ill patients who need intensive care. Acute kidney failure can be fatal and requires intensive treatment. However, it may be reversible if you're otherwise in good health. You may recover to normal kidney function.
Erth, so I heard there are 3 stages of the causes of acute renal failure. Can you explain those to us?
Absolutely, Orlando. Well, we have a pre-renal failure, which symptoms are arrhythmias, which means irregular heartbeat, myocardial infarction, which is a heart attack, dehydration, which is an excessive loss of body fluids, and eclampsia in pregnant women, causes seizures, and sepsis, a blood infection that can lead to organ failure and death. And then we also have the intrarenal failure, which is a more advanced kidney failure. And the symptoms of those are nephrotoxins, which is an exposure to toxic substances, myopathy, which causes muscle diseases, papillary necrosis, which is a disorder of the kidney in which all or part of the renal papillary dies, and what we call crush injuries, which is a prolonged continuous pressure on muscle tissue. And we also have what's called vasculitis, which is the inflammation of the blood vessels. And then you have the more advanced post-renal failure, in which you will have bladder obstruction, which is a blockage at the base of the bladder, a ureteral obstruction, which is the blockage in the urinary tract, and last is the urethral obstruction, which blocks and slowly disrupts the normal flow of urine through the urinary tract. And now, to further expand on the disease, are my colleagues.
Hi everyone, I'm Janelle, and I'm going to be discussing signs and symptoms. So for the first signs and symptoms, we have edema, which means fluid retention. Fluid retention or generalized swelling is a common initial symptom of acute renal failure. This occurs for the same reason that you may have decreased urine output. Your kidneys are not filtering out excess fluid, so it accumulates in other parts of your body. The first place that you will notice swelling is in your extremities, such as your hands and your feet. Then swelling can spread to your face and even your abdominal area in more serious cases. Immediately tell your doctor if you notice any swelling. Next we have drowsiness. Drowsiness is an early symptom of acute renal failure. You may become drowsy because an imbalance in your body's electrolytes can cause you to feel sleepy. This initial symptom is a general symptom of multiple conditions and a side effect of many medications that you may be taking. Therefore, you are feeling drowsy and are suspecting acute renal failure. Look for other symptoms associated with ARF. Always let your doctor know if you suddenly experience any drowsiness. Next, we have shortness of breath. Failure of kidneys to remove excess fluid may cause shortness of breath due to extra fluid in the lungs. May also be caused by anemia. Next, we have fatigue. Healthy kidneys produce the hormones erythropoietin that stimulates the bone marrow to make oxygen-carrying red blood cells. As the kidney fails, they produce less erythropoietin, resulting in decreased production of red blood cells to replace the natural breakdown of old red blood cells. As a result, the blood carries less hemoglobin, a condition known as anemia. This can cause feeling tired and or weakness. Next, we have confusion. Confusion is a symptom that usually occurs after a decrease in urine output, swelling and drowsiness. This is a sign that kidney function is continuing to worsen. Confusion occurs because there is an imbalance of electrolytes that causes your brain to function inappropriately. You should seek immediate medical treatment if you are feeling confused because your case of acute renal failure may be worsening. Next, we have nausea. Nausea, high levels of urea in the blood, which can cause nausea. Then the next one, we have flank pain, which means pain in the back just below the rib cage, right over here. Polycystic kidney disease, which causes large fluid-filled cysts on the kidney, and sometimes the liver can cause the flank pain. Next, we have hypertension. High blood pressure can cause damage to the glomeruli. Glomerular disease damages the glomeruli, letting protein and sometimes red blood cells leak into the urine. Sometimes, glomerular disease interferes with the clearance of waste products by the kidney, so they begin to build up in the blood. Loss of blood proteins like albumin in the urine can result in fall in their level in blood serum. In normal blood, albumin acts like a sponge, drawing extra fluid from the body into the bloodstream, where it remains until the kidneys remove it. But when albumin leaks into the urine, the blood loses its capacity to absorb extra fluid from the body. Fluid can accumulate outside the circulatory system in the face, hands, feet, or ankles and cause swelling. Last, we have urination changes. A reduction in urine output is one of the first signs of acute renal failure. This occurs because your injured kidneys are no longer filtering blood to make urine. This can be because there is a reduction in blood flow or there is a dysfunction within the kidneys itself. Oliguria, which means decreased urine output. It's less than 500 milliliters urine output in a 24-hour period. Polyuria, which means excessive urination. It's greater than 2.5 liters in a 24-hour period in adults. Anuria, urination stops completely. No urine output or less than 100 milliliters in a 24-hour period. And I'm Janelle, reporting live from Seattle.
Hello, I'd like to order french fries, a burger, and a milkshake. This is a library. I'd like to order french fries, a burger, and a milkshake.
Hi, this is reporter Herland, and I'm going to talk about how to diagnose acute renal failure. There are 3 simple tests to check for kidney disease. First, blood pressure. High blood pressure is the second most common cause of kidney disease. High blood pressure may also happen as a result of kidney disease. A blood pressure of 140/90 or higher is called high blood pressure. A urinalysis is a test that checks a sample of urine to the amount of protein, blood, or red blood cells and white blood cells, and other things. Protein and red blood cells are not normally found in the urine, so having too much of any of these can cause kidney disease. Next, glomerular filtration rate. The GFR tells how your kidneys are working to remove waste from your blood. It is the best way to check kidney function. Urine output measurements. The amount of urine you excrete in a day may help your doctor determine the cause of your kidney failure. Urine tests. Analyzing a sample of your urine, a procedure called urinalysis. may reveal abnormalities that suggest kidney failure. Next one is blood tests. A sample of your blood may reveal rapidly rising levels of urea and creatinine, two substances used to measure kidney function. The next one is imaging tests. Imaging tests such as ultrasound or CT scan may be used to help your doctor to see your kidneys. Last one is removing a sample kidney tissue for testing. In situations, your doctor may recommend a kidney biopsy to remove a small sample of kidney tissue for lab testing. To remove a sample of kidney tissue, your doctor may insert a thin needle through your skin and into your kidney. This is Herland Martinez reporting live, Stanford, California.
Welcome back to our show. Because today is such a special day, we have invited a special guest on set, Dr. Kaur, a urologist from Stanford Hospital, here to explain medications and treatments for acute renal failure. Hi, Dr. Kaur.
Hello, Rolando.
How are you doing today?
I'm doing well, thank you.
Can you explain the meds and the treatments for acute renal failure?
Many medications can cause acute renal failure. For example, antibiotics, blood pressure medications, medications used for cancer, dyes used in medical imaging testing, and medicines used to treat HIV, ulcer medicines, and some illegal drugs also.
So what are the treatment options used to treat acute renal failure?
Primary treatment for acute renal failure is to prevent further damage, and your treatment options will depend on what's causing your kidney failure and illness or injury that originally damaged your kidneys. As the treatment options, we have to balance the amount of fluid in your blood, control blood potassium, restore blood calcium levels, and dialysis to remove toxins from your blood.
And for what we were all waiting for, what medications can cure acute renal failure?
Well, it depends on your doctor. Your doctor will work to prevent complications and allow your kidney time to heal. For pre-renal failure, blood pressure and blood volume must be restored. Diuretic agents like mannitol or a loop diuretic like Reliza are most often used. Diuretics are given because when you have acute renal failure, the amount of blood, the amount of fluid you intake is not equal to the amount you release. So the kidney is not able to excrete the fluid, so that causes lower extremities edema. And drugs given intravenously to lower serum potassium include hypotonic glucose and insulin, sodium bicarbonate, and calcium gluconate.
Okay, Dr. Kaur. So how long does it take to recover from acute renal failure?
Treatment for acute renal failure typically requires a hospital stay. How long you'll stay depends on the reason for your acute kidney failure and how quickly your kidneys recover. So it basically depends on your body, how it takes it.
Well, thank you, Dr. Kaur, for coming to the show with us and explaining our viewers medications and treatments to treat acute renal failure.
Thank you for having me here. It was my pleasure.
Thank you.
In 2004, the Acute Dialysis Quality Initiative Group published the RIFLE classification of ARF based on the changes from the patient's baseline, either in the serum creatinine level, glomerular filtration rate, or urine output. So in this charting, we will need to know what GRF are. It's a glomerular filtration rate. It's a test to check how well the kidneys work. The most common way to classify acute renal failure is using RIFLE. RIFLE Class R of risk of renal dysfunction indicates a reduction of GFR of 25%. This is related clinically by a rise in serum creatinine of 50% of baseline or urine output of less 0.5 ml per kilograms for 6 hours. RIFLE Class I, or injury to the kidney, indicates GFR decreases of 50%. It is reflected by the rise in serum creatinine to double the baseline value or urine output less 0.5 ml per kilograms per hour for 12 hours. RIFLE Class F, or failure of kidney function, represents a GFR or decrease of 75%. Serum creatinine is trebled or urine output is less than 0.3 ml per kilograms per hour for 24 hours of anuria presents for 12 hours. RIFLE Class L, or loss of kidney functions, occurs when complete loss of kidney has been present for more than 4 weeks. RIFLE Class E, end-stage kidney disease, represents loss of kidney function for more than 3 months. Note: a patient can fulfill the criteria through changes in the serum creatinine or changes in the urine output, or both. Infections. Infection is one of the most common and serious complications. It is more common among renal failure due to severe physical traumas, burns, and other high decompositions, acute renal failure. Therefore, patients should pay attention to hygiene of oral cavities, skin, and privates, as well as infections of venous, catheter, and catheter. Cardiovascular complications. Arrhythmia is often caused by electrolyte disorder, acidosis, and retentions of waste and toxins. Heart failure is mainly due to water and sodium retention and increased cardio load. Treatment for acute heart failure due to acute kidney failure is mainly to dilate blood vessels and diuretics. Nervous complications. Patients will feel headache, sleepiness, muscle cramps, coma, and epilepsy. These complications are due to retentions of toxins, water poisoning, electrolyte disorder, and disturbance of acid bases. Digestive system complication. It manifests as loss of appetite, nausea, vomiting, abdominal distension, bleeding, or metabolic acidosis. Bleeding is mainly caused by gastrointestinal, mucosal erosion, or ulcer. An early prevention dialysis can help reduce the incidence and mortality of gastrointestinal bleeding. Blood system complications. Sharp decline of renal function can cause the reduction of erythropoietin and anemia. Some patients can have a disturbance of blood coagulations and have bleeding tendency. Metabolic disorder, metabolic acidosis, high blood potassium, low blood sodium, all are dangerous complications of acute renal failure. This is Amanda reporting to you live from San Jose, California.
Step
Hi, my name is Liza. You've met my twin sister earlier, Ling Ling. Now I'm going to discuss to you about patient teaching on a patient who's been diagnosed with acute renal failure and what to teach them upon discharge. Number one, we're going to teach them about medications, special blood pressure medications, because a controlled blood pressure, it helps your organs. A high blood pressure, it destroys your arterioles, and you have it in your organs, you have it inside your lungs, in your heart, especially in your kidney, and you don't want to destroy your kidney. And then number two, we have the diuretics. And number three, you have to teach the patient how to take their medications as directed by their physicians. Next is diet change. We have to teach our patient how to change their diet, especially if they're diagnosed with acute renal failure. They have to limit their protein intake because an increase in protein, it means an increase in amino acids, and it can result to a diagnosis of encephalopathy. And then next is they have to limit their phosphorus intake, because the kidneys may not be able to get rid of those extra phosphorus. This can reduce to calcium in your bones, and then it'll make your bones weaker. So we have to limit our phosphorus intake. And then foods that are high in phosphorus, they're your dairy products, your beans, your peas, and your nuts. And phosphorus also comes in liquids. They're your cocoa, your beer, and then your cola drinks. And then patients need to also limit their sodium intake, because where sodium is, water follows. Hence, edema. And then foods that are high in sodium, they're canned foods. They're your cup noodles, really high in sodium. They're your chips, which was really good, but they're very high in sodium. And then your sausages, your deli meats. And then patients need to also limit their potassium intake, because your kidneys, they're the main organ in charge for acid-base balance. And then an increased potassium, it will result in hyperkalemia. Hyperkalemia gives you arrhythmia plus chest pain. You can be diagnosed with a heart attack, or you can have a heart attack with those symptoms. And then last, you have to consult your nutritionist or the dietitian to know the appropriate diet for the said diagnosis, which is acute renal failure, and how much intake you can have each day. And then next, we have to teach our patients how to weigh themselves daily. Why? Because it gives us a baseline of their normal weights, and then an increase of those weights or a decrease, it means that there's something going on. And then we have to teach them when and how to weigh themselves. We know it, but just for people who doesn't know, it's every morning, it's before breakfast, after you go pee-pee. And then we have to call the physician. The patients have to call the physician if there's a really high increase or a decrease of their weight, of their normal weight. And then we have to also teach our patients when to call the physician if any of the symptoms are observed. Number one, if the patient is having fever. Fever is equals infection. And they also have to call their physicians if they're having chills, cough, or if they're feeling weak. And then they also have to call their physician if they're having an itchy skin or pruritus, because that's a symptom of a chronic kidney disease. And then next is what to be alarmed for, or when to call 911 or any emergency. And then one, if they're breathing fast, if they're having tachycardia, or a fast heartbeat, if they're feeling confused, dizzy, and lightheaded. And then next is they're not urinating at all, or if they're urinating very little. And the next is if the patient cannot eat or drink because they're vomiting. And the next is if the patient is having sudden chest pain, because what I said earlier, hyper K, the potassium part, and we don't want our patients to have any MI episode. And then we have to teach all of these to our patient. We have to let them know, we have to educate them about the signs and symptoms, what to watch out for, or everything, the works.
Here are the faces of some people who were given a second chance in life by very generous organ donors. We encourage donations not just in goods, but if you can be a living kidney donor. And give life. For more information about donating and support groups, here are the list. National Kidney Foundation, Renal Support Group Network, Kidney Pancreas Transplant Support Group, Support Group for Kidney Transplant Patients and Families, Transplant Living, and some helpful articles. Number 1, what kidney donors need to know before, during, and after donating a kidney, featuring Dr. Carl Wilmer of Johns Hopkins. Number 2, 60 Lives, 30 Kidney, all linked, published by the New York Times and written by Kevin Sack.
Thank you for watching another episode of West Medical News. Today we learned acute renal failure, the pathophysiology, what it is, signs and symptoms, complications, how to treat it, and how to manage acute renal failure. Hope this answered all of your questions. Until next time, stay healthy and tune in next Saturday. I am your host, Orlando Guzman. See you soon.
5, 4, 3, 2, 1.
Ron file. R for resident. I'm gonna count. The effect of many medication.
Redo that. 5, 4, 3, 2. Next, glomerular.
Make sure you
And
choose and treatments for acute renal failure.
later.
Okay, one more.
What happened? It was alright? No. Was it okay?
It was perfectly fine. And the treatments to treat acute.
Yeah.
She started laughing.
She kept on staring at me.
Well, I need to stare at you. What am I supposed to stare at the camera?
Relax.
Wait, let me get some chapstick on. Why did the kitchen? Why did the kitchen cook the meal? Why did the kitchen? I keep saying kitchen. I can't say chicken now. What are the bloopers?
Let's go to the blooper.
Make a family first.
Can you make sure
Okay.
you put that in the bloopers?
Okay.
Go! Ready? 5, 4, 3, 2, action!
Reporting it live.
Okay, one more.